Patients will be followed up at 2 time points in the CHEETAH trial. They will be followed up on the day they are discharged from hospital and also at 30 days following their operation. The 30-day follow-up is crucial as this is when we will be measuring our study's primary outcome. The primary outcome for the CHEETAH trial is the rate of surgical site infection at 30 days post-surgery. We will be using the internationally accepted definition of surgical site infection from the Centre for Disease Control. This definition is quite complicated, so we will collect data on each point that makes up the definition, and a computer will determine which patients meet the criteria for surgical site infection. The participant identification log should be used to track the patients enrolled in CHEETAH at your site and to keep a record of when their follow-up is due. Patients should be reviewed on the day of discharge from hospital, including an assessment of their wound. The follow-up at discharge from CRF should be completed. Follow-up should be completed by a CHEETAH trial team member who has been trained to assess wounds. Unlike in Falcon, because this is a cluster randomized study and all patients at your hospital are randomized to the same intervention, there is no need for the outcome assessor to be blinded. 30-day follow-up is crucial because this is when we will assess our primary outcome. The primary outcome is surgical site infection within 30 days of surgery, so follow-up should ideally be on day 30 or as soon after day 30 as possible, but don't follow up the patients before day 30. To minimize bias, it is very important that all consecutive patients captured in the CHEETAH register who meet the inclusion criteria are followed up at 30 days. This includes patients who were missed at the time of surgery and did not receive the randomized treatment allocation. So, if your site has been randomized to intervention, but gloves instruments were not changed for a particular eligible patient, they should still be followed up. Some patients may achieve the primary outcome of surgical site infection before 30 days. They should still be followed up at 30 days to assess secondary outcomes like mortality, reoperation, readmission. If a patient is still in hospital at 30 days, they can be followed up on the ward. You should plan 30-day follow-up before the patient goes home. Make sure you have the patient's correct contact details, including at least 2 contact telephone numbers, if possible, recorded on the patient contact form. Inform patients to expect to be followed up. You should also plan ahead who will do the follow-up and whether this will be in person or by telephone. To reduce the burden of patients, we prefer follow-up to be done over the telephone, unless the patient was planned to come back to hospital at 30 days for other reasons. In the CHEETAH trial, individual patient level consent for the intervention is not possible because it is the hospital rather than the patient who is randomized, and all patients at each hospital receive the same intervention. Consent is not needed to collect the baseline, intraoperative and in-hospital follow-up data, as this information is being collected as part of routine care. However, consent is required to collect the 30-day follow-up data. If you are following up patients by telephone, you should take verbal consent, but if you are following up in person, you should take written consent. There are 2 versions of a 30-day follow-up CRF, one for telephone follow-up and one for in-person follow-up. On the telephone follow-up version, there is a section where you should confirm the verbal consent has been taken. This is highlighted by the green box on this slide. The first page of the follow-up CRF should be completed by asking the patient about their experiences since surgery, but some of the questions on the second page should be completed by consulting the patient's medical notes. To help you complete follow-up over the telephone, a 30-day follow-up telephone script is available, which you can read to the patient over the telephone to explain the purpose of the follow-up, to take verbal consent, and to complete the follow-up itself. The following video shows the telephone script being used.
It is now 30 days since the operation, and it is time for the telephone follow-up call. There is a script available to support the conversation.
Hello, is that Mr. Omar?
Yes, it is, yes.
Oh, hello, Mr. Omar. Pleasure to talk to you. Just calling you from Sandwell General Hospital to ask you about a study you were taking part in.
Okay.
Yeah, so it's just regarding your recent operation. I'd like to ask you a few questions about your operation and your wound, and some questions about how you felt since you were discharged. Shouldn't take too long. Before we continue, the information we collect from you today is being used as part of this international research study called CHEETAH, and we're running it here at Sandwell and in lots of other countries around the world as well.
Okay.
The study is being run from the University of Birmingham and is specifically looking at whether we can reduce the chances of patients getting wound infections following surgery. Any of the information you provide today, we're going to keep confidential, and it's going to be stored securely, and only people directly involved in the study will have access. So, are you happy to provide your verbal consent to continue and answer a few questions?
Yes.
Thank you. It's very kind of you to help us. So the first question is, since discharge from hospital following surgery, have you returned to normal activities? Like, are you at work or just your family duties?
No, not yet.
Not yet. Okay. So for the following questions, can you just answer with me with a yes or a no? From the day of surgery up until today, have you had any of these symptoms? Pain or tenderness at the wound?
Yes.
Have you had any localized swelling around the wound?
Yes.
Have you had any redness of the wound?
Yes.
Has the wound felt hot to touch?
No.
Okay. Has there been any pus or fluid draining from the wound?
Yes.
Have you had a fever or a temperature?
No.
Have you been readmitted to hospital?
No.
And have you had another operation since the operation that you had initially?
No.
Okay. Well, that's really helpful. Thank you very much for your help. I'm just quickly going to double check that we've done all the paperwork for you. I think that's perfect. Thank you very much.
Thank you.
Bye-bye. The following video shows how to complete the 30-day follow-up form.
In order to complete outcome assessment for patients in the CHEETAH trial, I must now complete the CHEETAH 30-day follow-up form. This has already been pre-labelled with the patient's CHEETAH trial number. The first thing to do is to check whether there's anything in the hospital records suggest the patient has already died. If so, this must be ticked as yes, and the date of death entered. If this is not likely to be the case, you can follow up the patient either by telephone or by visiting them in hospital if they are still an inpatient. The first important step is to take verbal consent for collection and transfer of the 30-day follow-up data. If this is confirmed, yes must be ticked and then dated. There's then a series of questions relating to discharge from hospital and return to normal activities, symptoms from the wound, and re-interaction with the hospital with readmission or reoperation. Next, the form will ask how follow-up was done, whether this was over the telephone, in person, or from clinical notes. The remainder of the questions should be found from hospital records. These include, were wound swab results available? And if so, were any pathological organisms identified? Had the abdominal wound be reopened, either spontaneously or by a clinician? And finally, had an SSI be diagnosed by a clinician or on imaging? To complete the form, I print my name, sign and date it.
The next module covers data management in the CHEETAH study.